Now I'll ask Joe to take the stage here. See if I can load it.
Thank you for inviting me for this conference. Thank you, Chair. Thanks, ladies and gentlemen. I will catch my title immediately because it's not about differential pricing. I think we have to tackle our object more globally. It's about access to medicines. And access to medicines, of course, is a fundamental issue and a fundamental factor in every healthcare system. And there are a lot of factors which compromise that the patients have access to medicines. First and foremost, of course, for a drug to be available, it should be developed, and access to effective drugs relies on innovation research, and we have already heard some input. That's about availability. Besides drug development, regulatory issues can profoundly affect access to medicines. And one should notice that under the current European legislation, there is no mechanism to ensure that once a product is authorized by the European Commission or by the EMA, it's marketed in all member states. And the resulting non-availability can be a source of inequalities, of course. And in addition to these regulatory issues, we have the question of affordability, the third A. Availability, access, affordability, which it's concerning pricing and reimbursing issues, which of course are a competence of the individual member states, but nevertheless, reimbursement and pricing policies have also created interdependencies on other member states in Europe. And thirdly, we are confronted more and more, and there are more and more alerts on that we can be confronted with adequate supply of medicines. A triple A. Access to Medicine Index is an initiative, and you see that here that's a major concern. Is launched by the Bill and Melinda Gates Foundation, and is created to create an index on a three-dimensional issue, geographical, on the number of disease, and on the companies which are concerned. It's concerning more than 150 countries, but not Europe. And one of my issues is why not create in Europe an access to medicines indicator or barometer. We have noticed also that from different groups there is a plea for taking into consideration especially the problem of access to medicines. And one of the reports is the Patient View Quarterly, which has developed a 7-step plan in order to obtain greater access in medicines in recession-hit and poorer countries. And you can read it, I will not repeat what's on the slide. Greater transparency about drug pricing mechanisms, transparency about fair pricing policies, better dialogues between all the stakeholders, greater sharing of intellectual property, more donations, greater consideration of the impact of pharma marketing, and the subject of access to medicines should be handled by senior management within the pharmaceutical companies. Okay, that's our principles, that are things and steps which can, of course, promote better access. And of course, we have to take into account that equity between European citizens, between member states, is one of the key objectives also for all policy, especially for health policy, as the President of the European Commission strengthened it in one of his speeches. Recently, there was a declaration, even a declaration on access on medicine, which is focusing on 4 elements, saying, okay, we should evaluate what's happening after fiscal consolidation and the programs which are proposed by the European Commission in some member states. There's a plea for more transparency. There is a plea for cooperation at European level, and there's a plea for new innovation models. I think that these 4 points are right. And what can be done on that? Of course, there are some recommendations in this field which are very useful and which can be used as step up to tackle this problem in order, for instance, to consider coordination about European member states on joint procurement, to facilitate dialogue on cost containment, and so on and so on. Okay, there is some work to do. In Belgium, during our presidency, we have done some work, and we presented a paper called to make valuable innovative medicines accessible in the European Union. We had noticed that on basis on data of EMS, and I think some data of EMS also available in your documentation, that there is quite a difference between the difference of GDP, which is 1 to 6 when you call Luxembourg, and 1 to 4 to 5 when you eliminate Luxembourg. But we see that there is a difference from more than 1 to 10, 1 to 15 in some occasions when you are going to look to the uptake of innovative and valuable medicines. Not all medicines, I notice clearly, not all medicines are innovative, but when we are taking seriously into account on basis of health technology assessment agencies' assessments, we had ranked a list of that. And we saw great and huge differences. We were able to discuss this with the European Council, and one of the Council conclusions on the end of 2010 was to examine, based on the principles of solidarity, economic viable, efficient approaches to facilitate availability and access to true valuable, innovative medical products throughout the European Union, while respecting the principle of subsidiarity and the competences of the member states. Example given on affordability and sustainability on health systems. You can say, okay, that is the quadrature of the circle, but nevertheless we have to find out how we can promote this discussion. And there are some actions which are taken on the European level. First of all, we have the process on corporate responsibility in the field of pharmaceuticals, and it's an action or process which is led by the Commissioner Tajani, and they released an important report in April 2013, the so-called MOCA report, which is a mechanism of coordinated access to orphan drugs. You have to notice that the European Parliament in 2010 approved some regulations about orphan medicine, an action plan for rare diseases, but of course these are all regulations and recommendations. What's happening in practice, this is what is on issue today. And they arrived to some conclusions, namely that there should be a consensus that cooperation can create added value between member states and stakeholders when it's supported by the European Commission. When we are speaking about orphan diseases, orphan drugs, we are speaking about small groups of patients, and not every country, not every small country can of course have the expertise to evaluate that. We have to cluster them, and we have to make cooperation mechanisms in order to have a common approach in dealing data and in analyzing the proposals and assessing the prices which are presented. One of the issues is to launch a pilot for some drugs and see which are the problems which should be tackled. In this framework, in this working group, transparent value framework was also elaborated to see what should be evaluated. And it's not only on qualities, but it's also on societal value, which should be integrated in scientific evaluations. We have heard that yesterday also. And of course, there's also the willingness to further discuss other issues like pricing and financial issues in, for instance, the question of differential pricing. A second action is related to the reflection process towards modern, responsive and sustainable health system, which was launched during the Hungarian presidency, and for which 4 working groups were created. One of these groups is discussing on cost-effective use of medicines, and some reports are prepared on external reference pricing. We hope that it can be discussed in the first trimester of the following year. But it's clear that this issue of external reference pricing, in which one country refers for its prices to other countries and can create a race to the bottom, requires further consideration, not only on a technical level, but also in a broader societal perspective, also on a political issue. And we propose to continue this reflection between the member states on issues as availability, cost, safety, and innovation. Some actual findings, when we look to the data which were delivered by EMS, and you find them in your documentation, you see that there are persistent differences in the uptake and diffusion of innovative medicines in the different member states, and they are not related only by GDP differences. We see that higher income countries are likely to obtain lower prices compared with the GDP capita when we are standardizing. John Rovira made some analysis on that. We have delays in launching valuable medicines in lower income countries. And of course, we have to tackle also the problem of external reference pricing. Here is an example which is not published in the study of the European Commission about cost containment and pharmaceutical policies, but it's a simulation of savings and additional costs when we should apply European reference prices to a European median. And you see that, of course, these countries will profit are the high-income countries, but the countries who will pay are the low-income countries, and it's the case for Poland. Of course, it's our figures based on of 2007 situation of the whole pharmaceutical basket, but nevertheless, it gives an impression what could be at end, if we all that, and the price convergence on a European level. It's not because we have a European price that we have equity. And therefore, I think it's important to create new framework, new ideas, new models, and we have to take into account that we should focus both on efficiency, on utility, but also on equity, and it's my purpose. And therefore, we are discussing in an informal group of stakeholders about differential pricing. Differential pricing, in short, implies that a manufacturer establishes different prices for pharmaceuticals for reasons which are not related to costs, but we are according to the demand elasticity. More price-sensitive countries are charged a lower price than countries that are less sensitive. You will say, okay, there are price differences. Of course, there are price differences, but they are not in relationship to that as analysis is proven. The basic objective of such differentiation is to improve the equality of access to innovative pharmaceuticals for unmet medical needs. I should stress that. Of course, some economists have already taken into account the difficulties of such proposal, and recently someone said, okay, it's easy in theory but hard in practice. That's the reality, but it's not because it's hard in practice we cannot try to have a discussion on it. And how we will try that? We have 5 basic assumptions. such a model of differentiated pricing, or equity pricing should be a better name, is concerning fair and transparent pricing. We know that for the moment external reference pricing is creating a lot of obscurity and a lot of lack of transparency. We should base our model on fair and transparent in pricing, a benchmark price as starting point. With a win-win situation for poorer countries and a win-win situation also for industry in order to get some additional volume. The question cannot be new regulations, otherwise we should have 10, 20 years. I have the experience with the cross-border directive since the beginning. It takes 13 years for landing. We will now change, and that's a misunderstanding when we explain our proposal, not a change of the legal competences of the member states. We are not changing their pricing and reimbursement competences. And of course, it should be legally error-proof, and I think there are sufficient arguments for that too. How could we imagine such equity pricing mechanism? I think the basis could be the elaboration of soft law, a code of conduct, if you wish, based on a voluntary basis and based on protocol agreements between industry, member states, and supported by European Commission in order to get the Euro-proof legal approval. Secondly, of course, we are not talking about pharmaceutical markets as a whole, but our scope should be more specific, and we are talking about valuable medicines with high added value, which are responding to unmet medical needs and which have, of course, a market authorization granted. And I have to remember that 10 years ago, during the Germany presidency, such an initiative was already taken, and which is known as the Bremen Declaration, but with a limited scope, limited countries. And I think we should develop this idea on a more political way also. It's a like-for-like principle in that sense that, of course, we should base on a transparent ex-factory price with an acceptable return on investment. Confidentiality of net prices, it cannot be the issue that the additional discussions with the national member states lead to reference pricing in quadrat. And of course, price differentiation should prevent to apply external reference pricing, because it's a special regime based on an exception of public health. The economic background can be, of course, linking countries with a similar GDP, of course not related to the spending of healthcare in order to prevent free riding. There must be also a willingness of pay. I will not going into details. One thing which should be, could be also an element of such an approach is to launch a European market entry plan. You know that there is no commitment of pharmaceutical industry to launch their medicines, and we see, and I will come back on that, that it should be also interesting to have horizon scanning and a market entry plan. Of course, there should be stability and probably a monitoring by an external verification body. There are two critical success factors, or three. The first thing is the willingness to debate on such a proposal and to have political debates on new models of pricing and reimbursements, and not to be too conservative to say, okay, let's discuss with open eyes and with an open mind, knowing that some of our models are on the end of their life cycle, and we are talking sometimes about virtual realities. First thing is external reference pricing. When you look closer to what's happening in differential in external reference pricing, is that you see that you get a price compression. You create lower prices for high income people due to the parallel trade and political pressure also. But there's higher prices for low-income people because companies do not want to undermine their prices for the income market. And you get a double negative aspect, less funding to research and development on the one side and less access on the other side. And we should be aware of this paradox and tackle these problems, as I said, not only on a technical but also on a political field. Second thing is that, of course, external reference pricing should be not applied in the specific conditions I mentioned. For the moment, external reference pricing is playing its role, but it's also corresponding to a virtual reality in that sense that above this reference pricing, there are a lot of rebates, a lot of contracts, and so on, and we are comparing virtual realities. I don't think so. That is this responding to a principle which is a basic element of the treaty, namely transparency. Parallel trade. We know that parallel trade has changed and can change, and one of the last position papers on parallel trade by the European Commission was written 10-15 years ago, before the double extension of the European Union. I think we should reconsider, and of course a mechanism as differentiated prices or equity pricing should prevent on one or other means that, of course, these products on a cheaper price are exported to high-income countries, which has happened in the past, even to countries outside Europe. We can see that there's more and more interest in such issue, and a recent comment on that, on differential pricing of new pharmaceuticals, is published last week. Another report I would mention is the Priority Medicines Report for Europe and the World. One of the conclusions of the Belgian presidency in 2010 was to create such an update of this report, knowing that, of course, we cannot have all. We have to make priorities, but we have to make priorities also for unmet medical needs. And one of the elements of this report, which clearly mentioned, is that a system of differential pricing could be an equitable system for true innovation while ensuring access for those who need them. They are mentioning also some research priorities, but I think research can go along with more societal discussions. And to conclude, access to medicines is a complex and multifaceted issue. Of course, we are talking about innovative drugs. We are not talking about expanding volumes as such, but to tackle problems of unmet medical needs. And to address this issue, I think we need close collaboration between all relevant stakeholders. Of course, they are, and they will stay a responsibility of the member state, but they are also close linked to the realization of the European policy objectives such as the internal market, competitiveness, research and innovation, and public health, of course. And in our opinion, this means that the European Union needs to make sure that those policies are streamlined in a transparent fashion, and a political debate is urgently needed. And such an elements as differential pricing could be a part of such a debate. I thank you.
Thank you very much, Joe. Very happy that you are following through on what you set out during the Belgian presidency. Your conference, I believe, had the title Solidarity and Innovation in Pharmaceuticals. But things take time in the EU. Now these ideas are maturing. And as you heard from my president, Chris Wiebacher, yesterday, the pharmaceutical industry is definitely open for discussion on these concepts. Equity pricing, that's the term to take forward.